Of course, is the Royal Commission into Aged Care in this country, and Ian Henschke, who's the advocate for National Seniors Australia, has been keeping an eye on all this. Thanks for joining us again, Ian. There's been some really disturbing revelations about aged care residents actually being malnourished in a particular nursing home in Hobart.
Well, look, I think you can recognise that we've got a big problem when this comes to the issue of malnourishment. In fact, I heard a story last year about a woman here in Adelaide who had to go and hire a carer to go in and feed her father, who was suffering from malnutrition and dehydration. It is a much wider problem than just one place in Tasmania.
So tell us about this particular case, because it tends to be illustrative.
Well, if you actually have a look at some of the food that's put out there, it doesn't look too appetising. I know you have to vitamise it in some cases, but if you have a look at it there, I mean, it's probably not sufficient. There's some better-looking food there. They try and shape it into moulds to make it better. But we've got to realise that you actually have to sit there and assist people to be fed. I mean, the thing that we've got to recognise is some of the data that's just been released. I mean, for example, 85% of people in an aged care home have a mental health or behavioural condition. We know that 47% have got a diagnosis of depression. The figure is that around 52% of people actually have a diagnosis of dementia. So you really do need to look at this as not just an issue about food, but it's about care.
Yeah, and there's another statistic. There's another statistic or number that came out, at least related to that, that demonstrates the problems with care, because it pointed out a home where there were 420 residents in the care of only 6 staff.
Yeah, well, now that was at night, but I ask you, would there be a hotel in Australia that would have 400 people with 6 staff on at night? I mean, this is an example of what we're seeing. I mean, the problem that I see, Chris, is that we are hearing more and more of these stories, but we want to hear solutions, and this is why I don't think we can wait till the end of the Royal Commission to try and have some solutions. I mean, we've got to make sure that people are trained in dealing with people with dementia, because it may be that you actually have to sit there and help that person be fed, to give that person a drink. You don't just put the tray down in front of them and then come back 10 minutes later, and if they've eaten half of it, take it away. I was talking to someone this morning in preparation for this who regularly goes to aged care homes and in a management role, and they said that you will find some homes where the meal is the highlight of the day, and they actually take time with the patients, they sit there with them, they do the right thing. Other places just treat it and whisk it away, and it's just a sort of an interruption in their day. And that's not the way it should be. I think we've really got to look at this, Chris.
Absolutely, absolutely. Well said, Ian Henschke. Thanks for joining us again.
And look, just before I go, Chris, I do want to say my condolences to Tim Fisher's wife and family. I had some dealings with him during my time in the media, and I've never seen a person stand up in front of a crowd and talk so comfortably in front of Australians, and he is going to be truly missed.
Well said, Ian.